Marshall Public Schools families. This is Superintendent Jeremy Williams with an update for you about our learning models. When we moved to distance learning a couple of weeks ago, our plan was to return to in-person action on November 30th. Right now, our data still is not showing that that's the safest thing to do. It's just not supporting that return at this time. I look at our case rates in the state, in the county, and across Marshall, and they're as high as we've seen. We really need to get to a point where we have staff and subs healthy and able to work with students face-to-face before we can return to our hybrid model. At this point, I'm planning a phased-in approach returning to school, looking at the justification of that as we're looking at fewer in-person staff and lower potential for subs needed. Like I mentioned, you just need to have those healthy people available to come in and cover rooms so we can get kids back into school where we know we want them to be. The plan right now is for early childhood, Parkside, Westside, and Maytech to return to the hybrid learning model they had been in for the beginning of the year. That will happen on Monday, December 7th. So moving that back about a week and get more of our people back in and out of quarantine and that sort of thing. The high school and the middle school are going to remain in distance learning until Monday, January 11th. That holiday break in there that was already planned, that really plays part in that transition date, looking at where that falls and how many days we'd have in there. The waiting until January 11th with high school and middle school also gives us 2 weeks after any holiday gatherings before bringing everyone back together, that break and see where we're at with cases and such at that point. We know that older students tend to be better able to remain engaged and motivated in remote learning than younger students do. So that's part of the reason too with doing the middle school and high school on a different plan. And our goal is really to operate in that least restrictive model that we feel we can, and we can do so safely. Right now, we feel like this is our best option. We're going to continue to monitor positive cases and quarantines. Our nurses are still working, like I mentioned before. They're working closely and monitoring that, looking at with public health and with MDH, doing contact tracing and making all those contacts. They're still going to reach out to you and have contacts like you to let them know what's going on, and they're going to reach out to you too if you identify as a close contact. They're going above and beyond their duty right now through all this work, and we really appreciate your support as they're calling you. It's knowing where we're at with those cases. That's really what's going to get us back to school, and it's MDH calling, saying this, this is what we're seeing in the community. This is where we're at. So that open communication back and forth really makes all this possible. As we visited with local public health this week, talking about a decision, we're together encouraging families to take those extra precautions at this time. The governor announced it in his message recently too, but limiting exposure to other households, wearing masks, maintaining the social distancing of at least 6 feet from others in public, staying home when you're sick. If you have symptoms and not feeling well, just that staying separate is really important. Encourage you to please remain vigilant during the holidays. We know it's a hard time, but making the right decisions now is really going to help reduce the heartache in our community and help us return to that face-to-face instruction soon. Stay safe and stay healthy, everyone. Thank you.